Welcome back, dental assistants, to Lecture 16, Oral Surgery. Oral surgery is the dental specialty involved with removing teeth and treating jaw fractures, TMJ repair, bone and tissue grafts, removal of tumors and cysts, reconstruction of oral and dental deformities, and treatment of traumatic injuries. Exodontics. It's a term used to describe the extraction of teeth. Informed consent we've already talked about, but it is the permission from the patient or parent guardian after the possible risks and complications of the upcoming treatment have been explained. Medical history. Reviewing the patient's medical history is imperative prior to any surgical procedures. Special precautions may be necessary if the patient reports any of the following conditions. Recent heart attack. If a heart attack was suffered within the last 6 months, consult the patient's cardiologist or general physician for any precautionary measures such as decreasing or eliminating epinephrine. Heart murmur. It is sometimes necessary to pre-medicate patients with antibiotics prior to oral surgery if they have certain types of heart murmurs. Joint or heart valve replacement. If these procedures have been performed on a patient within the last 2 years, pre-medication with antibiotics is sometimes indicated by the patient's physician. Diabetes. If a patient is an insulin-dependent diabetic, it is recommended that the patient have a meal prior to any extended surgical procedures. Hypertension. It is recommended that the diastolic reading is below 100 in order to perform oral surgery. Risk of a stroke or heart attack increases with a patient having uncontrolled blood pressure. Kidney or liver disease. Increased bleeding times may occur with kidney or liver disease, so caution is always recommended when prescribing medication to these patients because certain drugs can further tax their kidney or liver. Pregnancy. Oral surgery should be avoided during the first trimester and on an emergency basis only during the other 2 trimesters. Current medications. Interactions with pain medication and local anesthetic with the patient's current medications can put the patient at risk. Possible interactions should be investigated prior to prescription and treatment. Oral surgery terms and procedures. Impacted teeth, soft tissue impaction. This is when the tooth is fully or partially covered by soft tissue. Full bony impaction is when the tooth is completely covered by bone. Frenectomy is the surgical procedure used to remove the lingual or facial frenum attachment. This procedure can help close a diastema and increase mobility to the lip and tongue. Diastema is the space that's located between teeth. Alveoloplasty is the removal of bone with a high-speed handpiece and surgical burr. Alveolitis is also known as dry socket. It's the absence of a blood clot in the socket following an extraction. It can be a very painful occurrence and be attributed to vigorous swishing, spitting, or smoking following an extraction. Biopsy is the removal of a sample of irregular tissue to be sent to a lab for analysis.